Perfect. So we will talk about how digital transforms the hospital in any kind of way. And maybe we can start with you, Jorge, as you, he's e-health director at a very well-known hospital in Barcelona. And maybe you can tell us what you're doing there.
Well, we started 5 years ago with an initiative called the Liquid Hospital. The Liquid Hospital is a word name for H from hospital and 2.0 from the bidirectional tools that we're exploring at the moment. And mainly what we do is we try to use those technologies that you're been presenting here to offer services and contents to patients, not to physicians, but to patients and the interactions with them. We have more than 40 projects in the innovation, up and running in the innovation department. And around 20 of them are in digital healthcare. So basically we have online care with a patient portal being used by more than 2,000 patients on a daily basis. We have telemedicine with more than 50 hospitals around Spain and other places in the world, with more than 400 connections per year. We have 3 online communities for patients with diabetes, patients with inborn errors of metabolism, rare diseases. We have 3 mobile applications, we have social media, so we try to use all these technologies to the benefit of the patients.
Maybe you can tell us why, especially in pediatrics, it's kind of nice to have digital health, or what it means for the young patients.
Well, I mean, it's very easy because, 3 years ago, the question that my physicians got was, doctor, can we be friends on Facebook? And then the doctors came and say, so what do I say, right? 2 years ago it was, doc, I read this super mobile application in the newspaper, why don't we download it and we use it and, let's, forget about the hospital. And this year's question is, doctor, do you have WhatsApp? So, this is the type of questions that my clients have for me, and it's either youngsters or on the other side very young parents, 30, 35 years old, very put into the technology world. Something that didn't happen 5 years ago is that our physicians ask our patients what type of mobile do they use, Android or iOS, so we can track our projects to them. So it's part of the hospital.
Cool. And how do these young patients manage their disease with these apps? Can they do everything with that? Do you think any improvement in managing their disease?
Yes. We have a very nice example with diabetes. We started in 2004 using basic phone, fixed lines, and then we started using email and then telemonitoring. And in these 10 years, we moved from 250 patients attended per year and 3 decompensations per week to 650 patients attended and 3 decompensations per year. Okay, so it's a really good results in terms of diabetes. Diabetes is one of these target diseases where digital therapies work very well for patients.
Okay, great. Before we dive a little bit deeper in this discussion, I would like to have the chance to introduce Alexandre to you. And you founded iLLUMENS, right? So maybe you can tell us what iLLUMENS is doing and what this all has to do with medicine and digital.
Okay, thank you very much. I am a professor of anesthesiology and intensive care in Paris Descartes University, and I will be associated in Columbia University in 3 months, which means that we are also moving to the big market of USA. With my friend Antoine Tenier, who is present here, we founded 2 structures. The one is iLLUMENS. iLLUMENS is an academic lab devoted to healthcare education and evaluation. And the second is Medscape, which is a little startup working with the iLLUMENS academic platform to launch serious games, video games, to train, evaluate the healthcare professionals. In fact, the point is that if you want to make improvement in healthcare, you've got 3 main pillars. The first one is research, clinical and basic research. The second is organization, because the hospital is changing. We are not working anymore alone. We are working with teams. We have to adapt to the changing world we currently observe. And the third is training. and evaluation. Why? Because the half-life of knowledge for medical activities is very short. More than 50% of what we have been learning at the university is changing every 5 years, which means that we have to train the people, and we tend to make them trained on the mannequin and also on softwares and not on yourselves. So since we make a lot of errors, it's better to make them on mannequins, plastic ones, and onto softwares and not on yourself. Therefore, when we arrive and take care of you, we are better. That's a good point. And don't remember that the main aim of our two structures is to make better education for better care and also for less costs. Because healthcare is really costly, and what costs a lot is bad care. So that's the aim of the lab and the startup associated with the lab.
So, I mean, from the digital perspective, it makes total sense to bring digital to the education, but you're a doctor yourself, you're a professor for anesthesiology and emergency care, as far as I remember. Usually doctors are a little bit reluctant to accept these technology. Maybe you can share your experience with us.
Yes, I think you're right. First of all, some doctors, old ones, are going to move and to retire. So we are now the new generation, and all our Y generation is going at the university and with their laptops or with their mobile, and some of them also do not come anymore to the university because they know that they have old-fashioned education. They don't want it anymore. They want to move and they want to change. And in the same time, we've got a new concept of blended learning. The school is changing, so they learn knowledge at home, and they come at the university to test their knowledge into acquiring skills and into acquiring and testing their attitudes, which means that we are now changing the education, the medical one, not only to be sure they have acquired the knowledge, but that now they have technical skills, non-technical skills, which means that they are able now to work together, to organize themselves, to be empathic with the patient, to speak to you correctly, to give you the good information and so on. And that's a new way to think about medical education.
Okay, great. Maybe, Jorge, you can also share with us how your doctors reacted when you told them, well, there are these cool apps, you should prescribe them to your patients.
I get this question in many conferences, and people ask me, are all your physicians liquid? And I say, no, I have tons of icebergs, tons of them, right? So, yeah, a lot of them, they're not interested in that, right? But, I think, like you, some of them will go away, and, our change management strategies try to go with the ones that really want to make the change. So, very simple, but that's what it works.
How do you convince them? Or do you think there is no chance to convince somebody who's very resistant to digital?
We really don't convince them. I mean, no matter how big or how good is any organization, there is always a couple of people wanting to do things differently, always, no matter how good or bad is the institution in any sector of the industry. And basically what we try to do is identify them and try to provide frameworks and help them so they are successful. So basically they convince the other doctors. Okay, so you never, I don't see myself convincing doctors through technology. I try to make doctors succeed using these technologies with patients so other doctors get convinced. And, it has happened, at the beginning, every single one of the projects that we started at the hospital started with, no, this is impossible, no? In fact, this is what people say, the word no is innovation, is embedded in innovation, is innovation, okay? So people say no at the beginning. And, but, as things get successful, right, you get a flow of physicians and nurses coming to the department and say, I would like to have something like that. Okay, so that's how it goes.
Oh, that's great. Do you see any gap in generation-wise? Do you think the younger generation of doctors is more accepting technology?
I have one of my most active physicians is 66.
Cool.
Okay, and the other one is 37. No, I think it has to do with culture, and I would say patient orientation more than culture. If you're really patient oriented, you understand that you really have, if these people are asking you, hey doc, Facebook, apps, WhatsApp, you really have to at least understand and make a decision to move towards one of these tools to help them keep better care.
Okay, great. Do you want to add something?
Yes, I would like to tell you that in the last discussion you've got with my colleagues, they mentioned that the first point to develop and to make it more familiar to doctors would be to demonstrate that it improves quality. The first thing that digital will help to improve quality of care. The second is cost containment, because it is costly and it is more and more costly. And currently, you may demonstrate that all these technologies will help to decrease costs. And this is a main motor of all these startups and all of these digital programs we are seeing here. And the third thing is the international development. Why? Because we know that emerging countries, developing countries, won't come from what we knew for medicine, for instance, after the Second World War in my country, and go through all these developments that led us to arrive nowadays. What they want now is to access the best care and today. So all these emerging countries are moving very quickly. And all of them will need and will use digital. And they will be really using it through different actors, which can be either startups, but also major companies. For instance, think about Google. The Google will bring with all his solution, tablets, Wi-Fi. All this will be done by them. And we will use and we will work with them and we will play with them, because they will be major partners in the healthcare field.
So, like medical studies or medical ongoing education is like quite practical field, right? Usually, if you go to med school, you learn from a person, you see it, you practice while somebody else is watching. What are the limitations to digital? When do we still need human-to-human interaction, and in what kind of extent can we replace this with digital?
Well, first of all, there will still be place for a human relationship between the masters and the students, because all of us have to do his own experience on real patient, and he won't be able to do it alone. So there will be always some part of the education which will be done and realized with a tutor, with a master. But what we know is that the hospital is changing. For instance, think about the big hospitals, the big cathedral hospitals, where we used to have people coming and staying more than 1 week, and costing a lot of money, of course, and being exposed to different medical errors. Iatrogeny, we call it, and we know that medical doctors are doing a lot of errors. Medical errors are the 8th cause of death in modern countries, twice more than motor accidents. So the point is that the hospital is changing. We are going to do in hospitals only things that we can't do outside the hospital. So it means that when the students are coming, they won't be able to see all medicine in the hospital. So they will use the digital solution. And I think, for instance, that we could reduce from 1 year the 6 years curriculum for our students, because with the simulators and with all of this digital solution, we can reduce, since we are able to show them things that usually it would take 4 years to access it, and we can do it in 15 days. For instance, listening to all heart sounds wouldn't be possible because the students are at the hospitals and they cannot listen to, for instance, aortic stenosis or pulmonary edema in 15 days. And with the simulation and with the digital solution, we can do it. 15 days, you can listen to all the sounds from the heart and the lungs. So it means that we can reduce the time for education. It won't take place of, obviously, clinical education at bedside, and also at the doctor's office. But I think it will be very, very important and more important.
Okay, great. And I would like to hear your view on that. What are the limitations for therapeutic apps in terms of when do we still need human or patient-to-doctor interaction, and where can apps help?
I think there are two main limitations. One is coming from the market. Mainly, as everyone says, we live in we work in a very complex industry, And if we take a look from just a business model perspective, I think healthcare is an industry where it's easy or relatively easy to create and deliver value, but it's very difficult to capture value, okay? Because we are very pilot-based, and in the end, well, these companies, they need money to survive. So that is one of the things, I remember, I don't know, 3 years ago there was an eclosion of, diabetes apps. Now the real winners, are finally, emerging. That is one thing. And the other is obviously the physicians, because, they need to be triggers of the change. And what is happening is that a lot of them, at least my experience in the hospital, is that they are worried that technology will bring away the human touch, okay? So they think it's technology or human touch, okay? And we're trying to convince them that first, that I think they already lost the human touch, because they don't touch patients anymore. They don't look at them in the eyes, and we have many experiences in Spain happening that. So that's number one. And we try to convince them that it's both things. So we have to use technology for the good things. Technology is great for scaling things fast. It is great for finding patterns and outliers. It's great for that, and we should use it for that. They don't need to compete with technology because they will be wiped out. Okay, so no need to, but they try to still think in those terms. And then physicians and nurses are great at empathy. Machines cannot be cannot show some of the emotions that patients need. Okay. And also, I think caregivers will be the leading forces for motivating patients to change behaviors. Okay, they will need digital therapies, but you will need like health coaches or something like that. As many of the people talked here in the behavioral medicine panel. And so these two things, I think we need to make an effort to convince physicians that there is that they have to move a step forward. So these to me are the two main limitations: the market on one side, and then the caregivers.
Thanks so much, and please applaud before you go to a break for these two innovators. Thank you.